Again, here shows this year. Here shows Milan, is Hangzhou, is means expand, is hepatocellular carcinoma liver transplantation is criteria, is a goal. Recently, is French is Strasbourg University, this center to do 136 liver transplantation is about 106 cases is suitable Milan criteria. The 5 survive is 77%. Is 30 patient liver transplantation suitable is Hangzhou criteria. 5 survive 44%. So same. So think is Hangzhou criteria, maybe China criteria, maybe is world criteria. This is some center use Hangzhou criteria is report here. Is international is the chairman was UCLA Bushdo professor in the international meeting. He introduced Hangzhou criteria. Here, this is we in Hong Kong is an international symposium. Is Bushdo is a reporter. Is introduced is a Hangzhou criteria here. So, the Professor Bushdo think is a Hangzhou criteria, except this tumor sign and with tumor biology. So better Milan or UCSF criteria. Do you not understand? Just say. Here show us is living donor transplantation for treatment of hepatocellular carcinoma. We how to write hepatectomy. Here show us is normal liver. We use QSA. Do you see? Here is oozing, bleeding is very little. Here is QSA. The QSA is a suck. Suck is a seal of liver. Then the glycis is usually mine, not injured. Here show us is a bile duct we cut down. Last tissue we cut it down. Now the cut down the right hepatic way. It's a pot way. Then take away right. The living donor is take away another recipient, another tomocyst. So you look very easy. Huh? Now we look is a plant. It's a right, the donor. Here's the right living donor, and the recipient is the IVC here, and the donor right is put away. Now is segment 8, segment 5 is into position. Into position. Now we blood flow. Here you write is finished.
How long it takes to finish? So
about 6 hours.
No. So you just resect the liver from a donor from the time of taking the liver and then starting the blood flow. What is the time span?
About 45 minutes.
So in this 45 minutes, the liver is not damaged?
No.
Because there is no...
No problem. We give injection some solution. Is no problem. Is temperature low down. Yeah. So no damage. Yeah. Very short time. Is cold is clear. Short time. This is sure. Usually we do a liver transplantation before we usually do downstaging. This means TSE, RFI, PI. The reduced tumor, then we do liver transplantation. Here shows is group is guide of hepatocellular carcinoma treatment. I really honor we take part in is delegated to China, Hangzhou. This is my name. Is taken by in the group, so very honored, I think. Now we take break. Start talk about benign liver tumor. Okay, we now discussion is about the benign liver tumor. The first is benign liver tumor is hepatitis cyst. It's a very common liver disease. This disease is benign. Usually, hepatitis cyst is can divided into the single or multiple. Multiple liver cysts, also known as polycyst liver disease. Polycystic liver disease. Usually between age 20 to 15, and it grows very slowly. Very slowly. Here show a lot of is large, is small cyst. Usually age is 50 years old. It's very common. So a lot of patients know any discomfortable is only ultrasound or CT scan find is liver cyst. Here is show us no symptom is earliest phase. Clinical manifestation like compressed symptom, abdomen mass can be appear in the latest phase. But imaging is a show examination show intrahepatic cyst space, occupation lesion. Ultrasound is the first choice for diagnosis. Here is ultrasound is a find is a cyst a lot of. For is a liver benign lesion is a treatment is a way including is a means ultrasound guided cyst puncture. The open surgery is a fenestration or unlawful of cyst. The cystectomy, partial hepatectomy. Sometimes we do a laparoscope, fenestration, or unifold of cyst. Last, if a patient repeated in the cyst infection, is a liver cirrhosis with port hypertension, upper bleeding, and jaundice is liver failure. We do liver transplantation. It's the last treatment. Here show us is liver, a lot of liver cells. Here open, we do is a large cyst operation. We do as a dissection. The open, the lobe, lobe here, the open. Is a second that liver is a benign tumor. Usually is a hepatohemangioma. It's a very common. Is a hemangioma can be divided into the single or the multiple. Like this tumor usually develop in any age. It is grows very slowly, can enlarge during pregnancy of a woman. So sometimes this woman is very common. Here CT scan is here is a CT scan show us is a lesion, it's a right liver, is a. Do you kind of understand how to differentiate is hemangioma is hepatocellular carcinoma different? You see here is blood flow, is a lesion blood flow. So for hemangioma is treatment we depend here if a tumor is larger more than 5 centimeter, located of liver age, is recently increased repeat. Any pain or distension, we usually operation resection. If a very large hemangioma and resection very large, with liver cirrhosis, we do liver transplantation. Sometimes we do hepatic artery embolization, but this is treatment we must be careful. Do you know if we do artery embolization, maybe cause biliary complication. Sometimes patient is jaundice, so be careful. So in our center, we usually not to do hepatic artery embolization or selective operation or follow-up. Cannot do embolization, so be careful, I see. Here show us very large is hemangioma, very large. Here, really the section. Now we discussion is third is liver benign lesion is a hepatoadenoma. Hepatoadenoma is usually the woman is very common, about 90%. A lot of patient women usually use contraceptive the drug for a long time. So it is the most single. Usually we picture biopsy is a diagnosis. So surgical resection as is in mind the treatment. This is adenoma. Like this patient, no history of HBV or HCV, no alpha-fluoprotein, tumor marker normal. If any history of a patient is taken is for a long time is contraceptive drug, maybe we diagnose as is liver adenocarcinoma. Adenoma. Sorry. Now we summary introduce our department. In our department, I think is a large department. Is a modern surgical ward here. At the 9th ward, is a total is 306 beds. In our center, including is a transplantation, liver transplantation ICU, the transplantation endoscope center, a major center. So it's, I think it's larger, like is a middle hospital. Yeah. Here show us is a modern open room. In our hospital, we usually do clinical is treatment, the department. I think basic research is very important. So in our center, we is a specimen data, is a bank. The bank, for example, is liver cancer, liver transplantation, liver cirrhosis, normal liver tissue, the body flow is a lot of specimens bank in our hospital. This is very important. It's for surgeon or physician, we must do the treatment of the patient, and also we do basic research. This is listen here. We center to do publish is here. For it's a larger center. I think is communication for foreigner is very important. Here show us is come from Taiwan, USA, the America, and area is Shanghai area, Taiwan area, and another kind of professor, the visitor our center. So 2007, I go to French for take part in ILTS conference. It's a symposium. During symposium, we very pleasure is meet is Professor Bushdo. He is chairman of international is a liver transplantation society. This is John Fang is a principal is liver transplantation. He is a UCLA is a very famous transplantation. Here show us is a part of liver transplantation recipe. This is a patient after the liver transplantation. Is a life quality is good. Some patients are married. Is good. Here is part of patient. Our center is a liver transplantation patient. This year take part in Australia is a liver transplantation game. Here is a China team that come from our center. Yeah. Our center patient liver transplantation take part in is get is a 6th gold medal. Yeah. Welcome to everybody's local website. Here show us is liver transplantation education, and our center is hepatobiliary pancreas disease international journal. This is our center is journal international, the index by SCI. Yeah. But now imperfect happened is must 2 years after. It's imperfect. Here picture show us our is group, the team, the staff. Here include clinical staff, basic staff. Here, very large.
Yeah. 那个
That means who?
This last year.
Oh,
Oh, here.
So here welcome everybody visit our hospital from any time. Visit our hospital, operation room, and welcome. Thank you everybody.